Receding gums, I don't even like those two words, it can be unattractive and it can also lead to tooth loss. And a lot of people avoid the typical gum grafting surgery because it can be too invasive and of course painful. But there is a new, less invasive technique to correct the problem. To have receding gums that go from this to this. This is Scottsdale dentist Dr. Erik Svans, and he's here to talk about the Chao Pinhole Gum Rejuvenation technique. And it's so good to see you back here. I remember
Thanks for having me.
You were here with Dr. Chao a couple of years ago.
Back,
yeah. So, okay, why is it such a big deal, first of all, if somebody has receding gums?
Number one, with receding gums, it's not just the gum tissue that's receding, but it's also the bone underneath that you're losing. So we only have so much bone to support the teeth, and if we're losing the gum tissue and the bone, well, then we could potentially lose our teeth.
Oh, okay. Well, obviously that's not a good thing. What causes it, though, to begin with?
Many different, there's a long list of things that can cause it, but typically periodontal disease, excessive brushing, poor brushing. Those are the main things that we see. Malocclusion, where your teeth are hitting wrong, so you're functioning on your teeth in a wrong capacity, can also cause it.
All right, so a long list of things. All right, let's talk about the Chao Pinhole Rejuvenation technique. I want you to kind of talk us through the procedure of how it actually works and how it's different than the traditional techniques we're used to.
So with the traditional technique, we're taking tissue from your palate, which involves cutting the tissue and stitching that site back closed, and we'll take that tissue and suture it into the site where the recession is.
Oh, it sounds painful.
Typically it's very painful. In comparison with Chao Pinhole Gum Rejuvenation, we're simply doing all of the work through a pinhole.
Literally?
Literally through a pinhole. We pass specialized instruments through the pinhole and release the tissue. And once we're done releasing the tissue, it will sit naturally where the gum tissue should be.
The way you described it to me is, if you think of like an arthroscopic surgery, you're kind of going inside and loosening up that tissue on the inside.
Exactly,
right?
Exactly.
Okay, and this particular technique, I mean, why did you choose, you've gone through lots of training and actually worked with Dr. Chao, who created it. Why did you decide to add this technique to your practice?
It was one of those things that I just couldn't unsee it once I saw it, once I saw the results.
Okay, right.
And I have a commitment to my patients to offer the best that's out there.
Yeah.
And it has a place where we didn't have a solution before.
Right, right.
We can treat an entire mouth in one visit. Traditional, we can only treat 2 to 3 teeth per visit.
With the old way, I'm just going to call it the old way.
Sure.
The downtime and the pain involved, I can't even imagine.
Right. Typically, downtime with that would be 1 to 3 weeks with pain medication throughout. With Chao Pinhole technique,
yes.
I'm typically the next day they're back to normal. They're taking maybe Tylenol or Advil, if anything, and they're telling me that they're having no pain.
That's amazing. Let's talk about the patient experience, because when you have a new technique like this, how long does it take to, let's say if you had to do a full mouth, are we talking like a couple-hour procedure, and what are some of the results that we can expect just after our first initial treatment? Sure.
So if someone has generalized recession on every tooth, we can treat that in 1 visit.
That is amazing.
Yeah, we had nothing even close to that before with the traditional or the old. It will take about 2.5 hours to treat every tooth in the mouth.
That is amazing. Now, will it come back? Will the gums ever recede again?
So with this procedure, we're adding that collagen inside that pocket between the tissue and the bone. So by adding that collagen, we're basically resetting the gum tissue, but we're making it stronger than it ever was before.
Wow.
So the tissue comes back thicker and more resistant to those problems that cause it in the first place. Of course, we have to look at those problems as well and address those.
Yeah.
But typically, we're resetting the gum tissue better than it ever was.
Wow, and prevention is key in something like this. Dr. Svans, thank you so much.
Thank you, Terry, for having me again.
Really good information. And here's some information for you. If you want to find a doctor who offers up the Chao Pinhole Gum Rejuvenation technique near you, you can call this number. It's 626-308-9104, and you can learn more by visiting pinholeacademy.com.